Hello fellow doctors and students, welcome back to this Neet PG INICET PYT series, and this is episode 6. Today I will be covering metabolic bone diseases. So let's get started. The first is scurvy. So in scurvy we can see that the metabolic issue is there is defective hydroxylation of proline and lysine residues which are required in clotting factors also, and which are required for stopping the bleeding. So there is defective hydroxylation of proline and lysine. So we can see there will be chymosis, perifollicular hemorrhages, and gum bleeds. So this is gum bleeds. These are ecchymosis, and this is scorbutic rosary. So how is scorbutic rosary different from rachitic rosary? In scorbutic rosary, there will be tenderness and these are sharp. But in rachitic we have seen that they were blunt and they were non-tender. So the on X-ray what you will be seeing. So first is subperiosteal bleed, which will lead to pseudo-paralysis in children. So there is subperiosteal bleeds which will lead to pseudo-paralysis, and the critical findings are these all are PYQs. So in epiphysis what you are seeing is there is epiphysis, and there is a sharp there is a ring around it, which is sclerotic ring around it, which is called as Wimberger's ring. Now you can see scorbutic zone, this black zone, which is called scorbutic zone, or it is also called Trummerfield zone. And now there is you can see there is a spur at the lateral side. So it is called Pelton spur and pencil thin cortex. So the cortex thinning will be present. It is called pencil thin cortex. So these all are radiological signs. Now where is vitamin C required? In biochemistry. In biochemistry we have seen vitamin C is required for tyrosine metabolism, folate, and synthesis of norepinephrine, and treatment is definitely vitamin C you have to give. Now coming to our next topic, which is osteomalacia. Here I have covered all the previous year questions. So first you have to see the X-ray. In X-ray there is triradiate pelvis. I'll make you understand this further. So in X-ray there is triradiate pelvis, or also called trifoil pelvis, and there are pseudo fractures which are called looser zones, or it is also called milkman fractures. So this is basically due to osteopenia and decreased mineralization. So the primary issue is decreased bone mineralization secondary to vitamin D deficiency or phosphate metabolism defect, etc. So therefore there will be osteopenia, and which will lead to bone softening. So the basic defect is decreased bone mineralization, which will lead to osteopenia and decreased bone hardness, or it will lead to increased bone softening. So osteomalacia is seen in young females, mainly young females. There will be proximal myopathy. There will not be distal myopathy. There will be, this is previous year question, there will be proximal myopathy, and the pseudo fractures which are generally not seen on X-ray. These are called milkman fractures, and this is also PYQ. The most common side is medial aspect of neck of femur. So this is a previous year question. The tumors associated ones were asked. So you have to I have made it simplified. So you have to classify it in fibro and osteo. Fibro means there will be collagen content, and in osteo there will be bone or cartilage. So osteo will be osteosarcoma and osteoblastoma. These all are not cartilage. There is no cartilage issue. So there is osteosarcoma and osteoblastoma, and in fibro there is fibrosarcoma and non-ossifying fibroma. So you have to remember this. These are very important. The tumors associated with osteomalacia. So in treatment, this is Stoss regime. I have never remembered this because it's too you have to cram it very much, but still you will not be remembering. So you can leave it. So for the sake of this topic, there is 3 to 6 lakh deep IM or oral stat, or over 1 to 5 days you have to give. This is vitamin D or calcium. or 2K to 5K, this is basically vitamin D, sorry, not calcium, it's vitamin D, and 2000 to 5000 international units for 4 to 6 weeks, and this you have to give daily, or 50 to 60K international units per week into 8 to 12 weeks. So this is the regime. You can skip it also. So the important topic is osteogenesis imperfecta. So in osteogenesis imperfecta, first I will tell you the metabolic defect, which is collagen A1 gene defect. This is the previous year question, collagen A1 gene defect, and this has been asked many times. Glycosylation defect of hydroxyl residues in type 1 collagen. This is the glycosylation defect. In scurvy, there was hydroxylation defect. In scurvy, there was hydroxylation defect and of proline and lysine residues. So this is important. You have to differentiate between these both. That in scurvy there was hydroxylation defect, and in osteogenesis imperfecta there is glycosylation defect, and which is in type 1 collagen. So I have also written there are 6 types of collagen: 1, 2, 3, 4, and 6 and 7. So 5 and 6 I have not written. So first you have to see skin. Why? Because skin में भी eye आता है, और one is like eye. So in skin there is the ratio is asked in surgery. So that is 1:3 of 4:1. So type 1 ratio type 3 collagen is 4:1, which is the final. During the healing process, what we see initially there is 1:8 of type 3 collagen, but later on it becomes 4:1. So this is also PYQ. Second is cartilage and connective tissue. You have to see there are 2 C's, or you can make it like C is like 2. So cartilage and connective tissue. Third is Ehlers-Danlos syndrome. E is like 3 में भी लास्ट में E आता है, और DE में भी E आ रहा है, तो Ehlers-Danlos syndrome. And fourth is basement membrane Alport syndrome, basement membrane of glomerulus, which is defective. So the type 4 collagen is defective in this, and we call it Alport syndrome. So you have to tell me Alport syndrome in comments also. And seventh is epidermolysis bullosa. So type 7 collagen is present at the junction of dermis and epidermis. Its defect leads to epidermolysis bullosa. About this you have also comment me. Okay. So now we will see the clinical features. This is of 2 types. If we look at the inheritance, this is of 2 types: autosomal dominant and autosomal recessive. In autosomal recessive, the patient is stillborn, but in autosomal dominant there are many defects like blue sclera due to the collagen issue in the eyes, recurrent fractures which are diaphyseal. You can the differential diagnosis is Bartlett baby syndrome, which has metaphyseal fractures, and these both are at different stages. Okay, so brittle bones, obviously, because collagen is not present or collagen is defective, so bones will be weak, and there are dental issues, deformed teeth. So the diagnosis will be you can also do prenatal diagnosis, which is through CVS, chronic villi sampling, not through amniocentesis. You cannot diagnose it by amniocentesis. You have to do CVS. And the treatment is bisphosphonates, osteotomy, Schofield meters. It is the name of osteotomy. Okay. So you have to tell me when we can do amniocentesis and when we can do CVS. You have to tell me in comments the timing. Which one is done in first trimester and which one is done in second trimester. Okay. Now I will show you this image of osteogenesis imperfecta. You can see there is blue sclera, malar hypoplasia, which is dental issue, pectus carinatum. This is the bone, chest bone or sternum, you can also say, impingement inside, and asymmetric chest bearing due to weak bones. So this is the main slide, and the defect and the metabolic defect also. So now we will move to osteopetrosis. So osteopetrosis, I have also teach you in renal tubular acidosis. Osteopetrosis is, it is also seen in type 3 RTA. It is seen in type 3 RTA. Osteopetrosis also called as marble bone disease or Albert-Schonberg disease. So what is the issue or the defect? The issue is the carbonic anhydrase 2 proton pump defect is there. It is a PYQ again, and there is decreased osteoclast activity and increased bone formation. So there is decreased osteoclast activity and increased bone formation. It means the bone are forming here. So there will be sclerosis. So the bone is thick, sclerotic but weak. This is important. The bone will be thick, sclerotic but weak. So it is also of two types, autosomal dominant and autosomal recessive. In autosomal dominant, there are pathological fractures just like osteogenesis imperfecta. They will heal normally, but the patient will be asymptomatic here. But in osteogenesis imperfecta, the patient was symptomatic, and there were also other symptoms also. And here autosomal recessive, there is myelofascic disease, and in osteogenesis imperfecta, the patient had still bone. So in autosomal recessive, there is myelofascic disease, which is extramedullary hematopoiesis. This is a PYQ. There is extramedullary hematopoiesis, hepatosplenomegaly will be there, and there is pancytopenia. All the counts will be decreased, and there is osteomyelitis of mandible. Okay, so you have to remember this. And there is Arlen-Mayer flask deformity, which is also seen in Gaucher's disease. Tell me in comments all the features of Gaucher's disease. Crumpled tissue appearance, crumpled paper tissue appearance. What are the different ortho points? What are the different ortho points in Gaucher's disease? You have to also tell me in comments. So now you can see here. So this is Arlen-Mayer flask deformity. This one. Okay. And there is sclerosis. So now moving to the Paget's disease. This is very important. This has always been the PYQ. So in here there is male more than female, and in osteomalacia, there was female more than male, and that was young female. And in this it is 5th decade, so that is old male, and pelvis are more affected than tibia, and SQST1 gene affected. This is also PYQ. Paramyxovirus, this is also PYQ. And there is increased osteoclast activity leading to bone resorption, followed by there is compensatory bone formation. So there are both lytic phase and blastic phase. But in osteo, what we have seen above in osteopetrosis, that there is increased bone formation. But here is increased osteoclastic activity leading to bone resorption, followed by compensatory bone formation. So now I will first tell you the blastic phase. There is skull which has thick cranial fossa, and that will compress on nerves 2, 5, 7, 8. So there you have the symptoms of all these nerves, 2nd, 5th, and 7th and 8th. So in comments you have to tell me the functions of nerve, the functions of these nerves, and symptoms also. So the skull will be warm on touch, and there is banana fracture like this. Okay. So now I'll so this is lytic phase. These are the images of lytic phase. There is osteoporosis circumscripta. So you can see this is lucency. This is much more lucent. Just give me a minute. Yeah. So now here you can see this is much more lucent. It is called osteoporosis circumscripta. Okay, it is seen in lytic phase. Now there is blade of Grasine also, which is again seen in lytic phase. So this sign is seen in early phases of Paget's disease, basically the lytic phase, in the diaphysis of long bone with a flame-shaped or V-shaped leading margin. So you have to just see the image and give the answer. Now there is mixed phase. I will show you the images of mixed phase, which is cotton wool skull. You can see there are little cotton wool like appearances on the skull, and there is ivory vertebra. What is ivory vertebra? There is a complete sclerosis of this vertebra. It is called ivory vertebra, or there is picture frame vertebra. So the margins, initially there will be margins. Initially the margins will be calcified, and later on whole vertebra will be calcified. So these all are findings of mixed phase. Okay, now moving forward, we can see the most common complaint in these patients are that there will be pain, so treatment will be calcitonin, which will increase the calcium. Okay, and the complications are high output cardiac failure and osteosarcoma. So this is important. In osteogenesis, in osteomalacia, again there was osteosarcoma risk factor. So this is the today's topic, and tomorrow I will be discuss another topic, mainly the fractures of tomorrow I will be discussing mainly the fractures, okay, of pelvis and of mainly pelvis and neck of femur fracture and intertrochanteric fracture. So guys, I will see you in the next lecture or the next topic. Bye bye, take care.